everybody. Welcome back once again to a new episode on Medwell Podcast. Today, you are with Hepons Oho, Ishimindi Jenanjirinshuti, and I will be your host today. I have a very interesting topic for you. You might have heard of anaphylaxis or allergy, but you do not know what it is. You do not know the signs and symptoms, how you can prevent it or treat it. Today, I am with a special guest. She is an anesthesiologist based at CHUK, and she focuses on anesthesia and simulation-based planning. Welcome to our podcast, Dr. Angelique Ntegerejwamhaye. You're most welcome on the podcast.
Thank you.
How are you feeling today?
I'm feeling okay.
Okay. We thank God. And people, our viewers, are very excited. They're more eager to hear from you and learn from you because they have heard more of anaphylaxis, allergy, but they have not yet got to understand really well what it means. So they want to know the differences, the similarities between allergy and anaphylaxis. So that is why we have you today. Can you tell them what is allergy, what is anaphylaxis?
So thank you for the question. As you said, some people confusing allergy and anaphylaxis. And when you said allergy and anaphylaxis, all of them, there is a reaction of our immune system. So in case of allergy, it is a simple one. It is a reaction, but is developed, it is localized. But in the case of anaphylaxis, it is in the case you develop allergic reaction, but is systemic and it is life-threatening and can be fatal if there is no intervention done. So that is why you need to know what is allergy, what is anaphylaxis.
Okay, thank you for reminding them. So this episode is not for medical students only. It is not only for doctors. It is not for those who are in the medical field only, because even saving a life is not for only people in healthcare field. So that is why we can also come back to you again. What are the signs and the symptoms of a person with anaphylaxis or allergy?
So person who develop allergy, you can find skin lesions, they say skin patches, where the skin they become swelling a little bit and redness, and you can find also a part of skin changes. You can patient can develop itching. Like simple things, but in the case of anaphylaxis, a patient is in a life-threatening condition. You develop swelling, can have facial swelling, eyelid swelling, mouth swelling, and also you can have airway edema, where the patient can struggle to breathe or even talk, and you can develop difficulty in breathing when you see someone is breathing difficultly and previously was okay, no time spending, and when they can develop, the patient even can collapse because blood pressure it is becomes low and the patient can collapse, even can die due to anaphylaxis. So anaphylaxis is very fatal and is a life-threatening condition with all those symptoms.
Okay, so you have told us more of the redness, swelling, but we also find those symptoms even in other disease. How can we differentiate it from other disease, like the differentials of anaphylaxis and other conditions?
So what I can say first, we can start with risk factors of anaphylaxis so that I can able to explain well to the listener of this episode. The risk factor of anaphylaxis is food. There is some people who become allergic to some foods or some, depending to people, some are allergic, other are not allergic. There is insect bite can be can induce to you toxin and can cause allergic reaction, and also I can say some medicine, some medications. So if you are with if you are someone in the restaurant or at home, they take some food like milk, like eggs. There's some food who is rich in protein, who is more allergic, like eggs, fish, milk. So if you have someone and previously is healthy and you take something and you see some symptoms, you need to think first on allergy. For example, you are in the forest or we are in the garden and someone they develop symptoms and currently is healthy, you think maybe it's insect bite who can cause it, so you need to think about quickly because previously this person was normal. And also in part of medicine, you are in the hospital, for example, you are at home, you bring medication to someone, and then after taking example tablet or patches and you see manifestation or sign and symptom which was not there before, so you think it is allergic reaction. So in that time you need to react quickly. So that's why you need to keep in mind, if you need to keep in mind is a person previously healthy, if it's a kid or adult, is it previously healthy? If it's previously healthy, it's okay. I can differentiate even if someone who fell down, like kid fell down, they can develop skin redness, but skin redness of trauma is different to allergy, because allergy, you see, no one traumatized you and there is no blood or sign of trauma, so you can able to differentiate from allergy.
Okay.
That's what I can say.
She said something and made me remember, like, there's a time when I go to like a certain place, a new place, there's new food, new menu, and like you are trying to explore new foods,
Yes.
everything, and maybe you might be allergic to something there. You do not know, so take caution. And thank you so much for that. And then we are asking ourselves, how can you help someone with anaphylaxis? Because yes, we prevent it, but sometimes it can happen.
So thank you for the question. You need everyone needs to know how can help someone who develop anaphylaxis. As you know, in our setting, in developed country, everyone they consult allergic specialists, so that you know I'm allergic on eggs, I'm allergic on milk, so that you need to avoid it in your new life.
Yes.
But in our setting, there is no allergic test generalized done, so you can be allergic on anything or any medication, so we need to be cautious. So the preventive measure first, if possible, you need to know I'm allergic on this or I'm not allergic on this. And if, for example, if you have like kids at home, you need, if you are introducing a new food or you need, don't mix. It helps you to know, is it allergic on this food or not. For example, if you are introducing fish, take fish, but don't mix with other things. If you take fish and you take eggs, if you become allergic, you didn't know, is it fish, is it eggs, is it milk? But you introduce slowly to know. If I give fish and allergic on fish, you know that is it fish. And if you take eggs, you will be able to identify which food I'm allergic on. So you need to avoid mixing those things with which can predispose to you to allergy and you didn't able to differentiate it. Another things, if the preventive measure, if you go in the forest, you need to be careful that there is some insect or plant which can cause you allergy. You need to be careful, and you need to be cautious, not attaching on anything without know. And you need to go with some medications which can help you in case you face this issue of anaphylaxis. And in terms of medicine, if you are giving to someone medicine, please follow and remember that this patient developed symptoms from this medicine. Remember to avoid it to use next time. That's what I can say in preventive measures.
Okay. And so we have heard the preventive measures. But then, if it happens, what can you do? If then it happens, you have prevented it, but maybe certain issues, stuff's happened, and then boom,
So thank
anaphylaxis. How
you.
can you treat it?
So thank you for the question. If it's happened, normally everyone at home, you need to have epinephrine. And epinephrine, it is the same as adrenaline. It is our natural hormone who is secreted by our body in case of stress. So this epinephrine, it is the medication who is help you in those management of anaphylaxis. The first line is epinephrine. So there is what we call Epipen, is epinephrine is able to use, but you don't have it. We will show you the picture, or when next time we bring it, we will show how to use. But in the hospital there is different form of epinephrine, IV epinephrine, but this Epipen everyone is supposed to have at home. And then those who, even your daily activities, you need to have Epipen, and you need to recognize that everyone at home is know the location where they can find this Epipen. And then if a kid or someone developed those anaphylaxis, so you need to take Epipen and you inject to your thigh, on the outer part of your thigh, and then it's help you to calm symptoms while waiting for help. And we advise you, if you develop anaphylaxis, don't leave. Receive this epinephrine, and then you stay where you are, and then you call ambulance for help, because epinephrine, they have a shorter duration of action, like 3 to 5 minutes. If you receive it and you say I'm okay, you can develop the symptoms after the off of this medication. So you need to stay where you are, if it's in the office or if it's at home, and wait for ambulance for help to bring you to the hospital for further health facilities.
Okay, yes, thank you. I feel very enriched. You cannot understand, because I myself, I'm also a medical student, but I have learned a lot. So I think you also have also gained a lot from this episode. And yes, you have heard it from Dr. Angelique, and she is a professional. And you have to know this, because anaphylaxis and allergy, they are like, I can say that we are going with them on our podcasts, because you cannot know whatever we feed on, what we touch, what we like, what we are always interacting with. And yes, you need to take notes from these episodes and get to know more. So stay tuned to the next episode on Medwell Podcast. See you next time.